welcome to another episode of TV on TV. I'm State Representative Tommy Vitolo. You're watching Brookline Interactive Group. Today is Thursday, April 7th, and we have a great show for you today. Today, our guest is Brookline's new Director of Public Health and Human Services, Sigalle Reiss. The interview was recorded actually a week ago. And so I'm wearing a different tie, but otherwise, it's a great interview, and I hope you'll watch and hear my conversation with Sigalle about COVID, about non-COVID issues in public health. Lots of good stuff worth getting into. I also, I haven't held it up in a while, so it occurs to me I ought to. I want to remind folks, this is me. You can call me anytime, 617-872-8921, and you can reach me at tommy.vitolo@mahouse.gov. The phone is great for issues of a personal matter. The email is probably better for issues around a particular bill or issue that you want to communicate with me about. And I know how to turn my ringer off. And so that means you should just feel free to call when it's good for you. And if I'm not available, I'll get back to you. I was just looking at my phone and turning my ringer off for the show. In any case, I do want to get to the news before we get to Sigalle Reiss. And so let's do that. Fighting is expected to increase in eastern Ukraine as Russian forces continue to advance. Western countries have increased sanctions in response. President Joe Biden extended his federal student debt moratorium yesterday, giving borrowers until August 31, 2022 to resume payments. No criminal charges will be brought against the Minneapolis police officer who shot and killed Amir Locke in February. Omicron subvariant BA2 continues to spread. COVID-19 cases in Massachusetts have increased 27% in the last week. The state is expected to receive $525 million over the next 18 years in an opioid-related settlement with Johnson & Johnson. Attorney General Mwra Data announced that the money will be distributed to cities and towns. The last round of tickets for the U.S. Open hosted at the Country Club in Brookline will be released on April 14. Starbucks baristas in Brookline and Allston will host a union ballot count at the Brookline Booksmith next Monday, this coming Monday, I guess you might say. And lastly, I just want to flag that this Saturday, the recently identified remains of Charles G. McMacken, an American airman who was killed in action in World War II, will be waked and buried in Brookline. The public will pay their respects from 9:30 a.m. until noon on Saturday, April 9th at Bellowday Funeral Home at 376 Washington Street. Charles G. McMacken, Staff Sergeant, U.S. Air Force of Revere, was on August 1st, 1943, during a combat mission called Operation Tidal Wave in Romania. It'll be a sad day, but important for closure for the McMacken family and for those connected to his family. Folks, without further ado, we do want to get to the interview here on Brookline Interactive Group. Looking forward to share my conversation with Brookline Health and Human Services Director Sigalle Reiss. Stay tuned. It's coming up next.
5, 4, 3, 2, 1.
And as I mentioned, today's guest is Public Health Commissioner Sigalle Reiss, new to this role, but not new to public health. Sigalle, thanks for coming on the show.
Great. Thanks for having me. I'm excited to be here.
And, in my show, we don't waste a lot of time. We get right into it. So, folks in Brookline haven't had the chance to meet you yet. Tell us what you've been doing your whole life. How'd you end up here?
How'd I end up here? Well, I think like most people, I did stumble into public health. I think I'd say pre-pandemic, a lot of people didn't know what governmental public health did in your community, specifically on the local level. So I knew I was interested to understand how diseases moved through a population, but I didn't really know what field that was. I in my undergraduate degree, I did study anthropology and sociology. So I was really interested in culture and how people interact and the health aspects of that. So I was looking to go to graduate school, and a friend of mine worked at a local health department. She said, well, if you're interested in epidemiology, there's an opening where I work. And so like I said, kind of stumbled into an inspector role. I actually started my career in local government in the city of Taunton. And then after a few years there as an inspector, and then I was promoted to assistant director. And I also got my master's in public health from the BU School of Public Health. And then at that time, a position opened up in the town of Norwood. And I was fortunate to get that director position where I was for 15 years before coming to Brookline. And I think that really laid a good foundation for me to learn not only the public health, but also the administrative side of being a department head in municipal government.
And so, you're now at the sort of near town hall. You got your own building, which is pretty great. Tell us about folks kind of have an understanding for what the police department does and what their limitations are and what the chief of the police department does. Same thing with fire and DPW. But I think some folks don't have a really clear understanding of what the role of the town is with respect to public health and the department, and then maybe what your role is within that department. So could you kind of give us a little, civics 201 lesson on public health as a municipal government service in a town in Massachusetts?
Yeah, and I think one of the reasons why I think it is difficult to encapsulate everything we do is because it is a very large, broad charge for public health. I do say on the local level, there's everything from the CDC to the State Department of Public Health and then your local health departments. There is public health on all levels of government, but I really call local health departments as the boots on the ground. And I think we saw that a lot with the pandemic response. And I think now people know what we do as far as communicable disease response and control. Contact tracing was a new term for many people. We've been contact tracing for 50 to 100 years, probably at the local level. Anything we're talking from TB exposure to smallpox, really doing investigations on diseases in the community. So that's a big charge that we have. And do it, like I said, way beyond COVID. We look at monitoring disease impact on the community. But there's also, I would say people know what the health department does and where they interact with it. So if you're living in substandard housing and you call us for a housing inspection, that's what we do. If you run a restaurant and you have a food permit, you're familiar with those activities. But I feel like not many people know the broad spectrum of what we do in the community. Our number one goal is to lessen the disease burden in the community, and that's everything from communicable diseases to chronic diseases and other infectious diseases. So things that might not be communicable. And a lot of times we talk about ticks and mosquitoes and the illnesses that we get from vector-borne illnesses. So the reason why it tends to be so broad is so many things in our environment affect our health. And I think, there are different ways that we protect the health of the community. Some of it's through regulation and enforcement of regulation. A lot of it is through community engagement and partnerships. And as we look to really drive that, target those efforts, I think one of the things I'm excited to do here in Brookline is to really have a data-informed approach and to do the work to make sure our approach and our policies are really strategic. So looking at doing a community health assessment and community health improvement plan, and really get to know, for me too, being new, get to know Brookline, what makes it tick, what are the motivations in the community, what are the resources, and understanding all that so I can really direct the department to have the most impact to protect the health, of all residents.
Now, most folks, when we think about healthcare, they're thinking about physical health, but the pandemic has actually opened folks' expectations around health to talk more about mental health. And in my office, I hear quite a bit about concerns around mental health, particularly amongst young people, teenagers, and other young people, but certainly across the spectrum. And how does your department engage with the community around mental health and provide support? Or is that something left for someone else altogether?
I think like most things, it's going to take a collaborative approach, and our department will have a role in that. I first want to go back to what you said, and I think a lot of people think about healthcare and their health in that respect, in the care they get from a physician or at a hospital or even preventative care such as vaccines. But so much more of your health is determined by the environment that you live in, the social determinants of health. And that's really the world of public health. And that we're looking to create the best environment for residents and for the community to have good health outcomes. And a big part of that, of course, is equitable and having the same access to those great healthy outcomes based on your social determinants, where you live, the food access that you have. It does include access to healthcare, but that's just one piece of the puzzle when you're looking at your own individual and a community's health. It's really the environment that has the largest impact. And that runs true same for mental health. And one thing I've never understood about our healthcare system is why mental health is sort of on a separate track than other health. We know that it's the same factors contribute to your physical health and your mental health and how they are so intertwined. But in our culture, we have two separate tracks of mental health and physical health. And I think what's interesting if we can better align that, because it's the same preventive strategies that we use, but for some reason our culture has separate tracks, and that's not just obviously Brookline in this country. It's, I think, around the world we see them differently and they're stigmatized differently. But to your question about what we can do with mental health, I think particularly in the response to COVID, we're seeing exacerbated circumstances with mental health and the increased need. I know, my department has a partnership with the Brookline Brookline Mental Health Center, looking to grow that. I think there's a huge gap, and there's really some areas where we can improve and provide better services around mental health. I think what our department is well situated to do is to really deal with in the prevention realm and the follow-up. So there's sort of three levels of prevention. You have primary at the community level, secondary and tertiary. And that's a spectrum of policies and programs that you can implement to help prevent disease. And it's everything from large community efforts, such as an anti-stigma campaign, to in the secondary, second level would be a screening tool around that's given more at let's say in the schools or to a population that might be at high risk. And then the third one would be making sure they have access to care. So it's sort of that spectrum of large base population to individual. And that's really where public health works best at in the prevention realm. I think when we do have individual cases in town that we can also look up with follow-up and making sure they have access to that care that they need and the resources they need to access that care. And there's all sorts of barriers to accessing mental health, health insurance being one of them. Finding caregivers that meet your need is always a struggle. So I think, like many things, it'll take a collaborative approach, but that there's a big role for the health department in that collaboration.
So let's switch gears a little bit. I know that the public health department does inspections, and so you're doing all kinds of different inspections at retailers, and one of them is tobacco. As a town meeting member for well over a decade, I was active in the tobacco control bylaws of town. In fact, I rewrote all of them. We had in our bylaws the description for how we would transition from workplaces that allowed smoking to workplaces that prohibited smoking, right? Offices and restaurants. So we got rid of all that because you can't smoke at work anymore, right? Come on. Welcome to the 21st century. Right. And we also ratcheted up tobacco control. And so we treated e-cigarettes as cigarettes, and we prohibited flavored tobacco, increased the age from 18 to 19 and then 19 to 21. And then most recently, town meeting implemented a policy that said, hey, if you're a smoker, that's cool. But if you're not old enough to be a smoker yet in Brookline, you're never going to be. And it did that by passing a bylaw that said, if you are born on January 1st, the year 2000 or later, you cannot buy tobacco in Brookline forever. And that's a really big paradigm shift. And it falls upon, and my understanding is it falls upon your department to enforce that. So how's that conversation going with retailers, with residents? You're kind of the ones who got to communicate all of this, and it's a big idea. How's it going?
Yeah, it is big. And I'll have to admit, it's one of the reasons why I was excited to take on this role, because I do feel like there's an environment where we can do some really cutting edge public health policies, such as this tobacco regulation. And just to back up a little, that history was really informative to me. I know many tobacco regulations, such as the flavor ban, such as the 21, increasing the age to 21, really started at the grassroots level. They started in municipalities in Massachusetts, and we've seen them spread across the country. So, I'm excited to be, like I said, on the cutting edge of public health policy like this. We know tobacco, number one cancer killer, clear link. If we want to, reduce our cancer rates, banning tobacco is probably the number one tool to do that with. So this will have a big impact on health. But I think, like you described, some of the challenges will be working with our retailers, making sure they understand the policy, working with the public, again, to help understand the policy. We are part of a regional tobacco collaborative where the state has funded some of this work. So we do have some assistance, with funding and with staff. There's one staff person for 7 communities, so that person's spread pretty thin, but that we will have some assistance from the state and from that collaborative to enforce it. I really think enforcement is one of the many tools we use with policy, that really education and awareness are the first tools that we use. Our goal is to have compliance. Our goal is not to be punitive with really all of our regulations. So I hope to really work with the retailers to make sure that they understand the new policy, and hope that this grows beyond Brookline, because I think it's a really good initiative, and I'm excited to work on it.
Well, that the state even prohibited flavored tobacco, including menthol, was actually a really big step. That was a bill pushed forward by my colleague, Rep. Danielle Gregoire from Marlborough, of all towns. The irony is not lost. But I was proud to vote in favor of that. And so we did that statewide. And again, obviously, any policy that's statewide makes it a little easier on our local public health department, because they don't have to explain that, no, we're not Boston, we're not Newton, we're not this other community, we have our own rules. But we got to start somewhere, and I'm delighted that we have. I want to talk about COVID. We can't talk public health in 2022 without talking COVID. But first, I want to start with the acknowledgement that in the last 2 years, the public health department has spent a lot of resources on COVID. And it's not like you suddenly had a bunch of new hires in March of 2020 to do that work. So my expectation is, in focusing so much on the dramatic and urgent needs of COVID, some other things may have been left behind, or at least left for another day. And I'm wondering, how are you doing on all of those things? How is that piled up? Have you caught up? Do you feel like there's still work to do? Give us some sense for what's been left behind in the plan for that. And then we're going to talk about COVID directly.
Yeah, and I think that's been a struggle for many health departments. It's almost, I feel like I have to relearn my job after 2 years of really being hyper-focused on COVID and the pandemic response. And that has really overwhelmed and overtaken all of our staff and duties here. But there have definitely been some things that have fallen behind. I think tobacco is one of them, that we're a little behind on educating our retailers that we just discussed. But also our, inspections, we redirected staff. And then again, I wasn't here when Brookline was doing it, but we did it across Massachusetts and all local health departments. All staff was redirected towards contact tracing at the beginning, and then moving on to vaccine administration and distribution, and communication and awareness around the vaccine, and then to, most recently with test kits. I think the number one role for us was really around trying to provide reliable, consistent communication in a constantly changing environment was really challenging. So required a lot of resources to do that, and to constantly be updating, trying to keep the public up to date on the, like I said, constantly changing. And a lot of times we would hear along with the rest of the public of policy changing at the state and federal level. So really difficult to pivot that quickly. But to your point, yeah, a lot of our services have fallen behind, everything from inspectional services to nursing services to our ability to engage in the community. Really, a lot of that stuff, building those collaborative relationships takes time and effort. And I think we have some work to do to rebuild all of that. On top of, we are still working through COVID. It is not over. We're really not in that recovery phase yet. I hope to be soon, but we are seeing some upticks and some up and downs, and we don't know really what the future with COVID will look like at this point. We are in a much better place than where we were in March of 2020. We know a lot more about the disease. We have better treatments. We definitely have the vaccine, which is our number one strategy to help combat, severe illness, hospitalizations, and death is that vaccine. And I hope as we move forward, we're able to really direct some of our resources to that. But again, I think your point was we're also looking to balance our existing duties. And like you said, we all had full-time jobs before COVID. And I think we need to start redirecting and looking back to make sure that we are meeting the needs of the community in all ways, while also keeping an eye on COVID. So stretched pretty thin for sure.
I'm going to exercise my prerogative as the host to do something I rarely do, which is actually lean in on a thing. And that is this very small thing. I have noticed, not just in Brookline, but definitely in Brookline, a proliferation of stores, typically restaurants, who have signs that say restrooms for customers only. And that's illegal by state law. And it seems to me that our public health inspectors, who are the ones who are interfacing with those restaurants and going into their restrooms and checking the toilet paper and the waste baths and all that, might inform them that, hey, you got to take that sign down, because that's not what the law says. The law says if a customer has IBS or some other digestive illness, they're entitled, whether or not they buy anything. The law says if you have 3 or more employees working, it's a public restroom for everybody, whether or not they buy anything. So I'm going to use this moment to mention that to you, and maybe that'll percolate through. But what I really want to do is ask you about COVID. And since we're talking restrooms, I want to ask you about the MWRA data, right? So as you know, the MWRA measures the amount of COVID in the wastewater. And that's this really interesting thing, because they're sampling everybody. Like, you can't escape the restroom. So should we be looking at that data? Is that useful, or is that just, more noise and more Twitter expertise without real expertise? What should we think of the MWRA data?
Yeah, that's definitely great data, because it's sort of our early warning signal. But I do say no data indicator can be looked at in isolation, that we have to be looking at the whole picture. So we're looking at wastewater data. We're looking at our community case data. We're looking at school case data. We're looking at our vaccination rates and our resources, and what, particularly in the hospitals, when we saw the big Delta and the big Omicron. And I think the key thing, the great example of how we have to look at the whole picture is looking at the difference between Delta and Omicron. The Omicron surge, when you're looking at pure case counts, was much higher than Delta, but Omicron in general was a more mild disease. But because the number was so big, even though it was a smaller percent of individuals had severe illness and needed to be hospitalized, because the number was so big, it still had a huge impact on our healthcare system. And then Delta, the curve was smaller, but more severe disease. So you saw an impact, big impact on healthcare. So looking at multiple data points is what we need to do when trying to evaluate and determine, whether we do a policy shift or whether we increase our messaging around, masking or vaccines. And I really feel like there's some room for improvement on our vaccine uptake, particularly with boosters. I think it was actually announced today that 50 and older are eligible for another booster, but I fully admit it's not clear, and the guidance isn't, everybody 50 and older go get a vaccine. It's if you need it, check with your doctor. If you're immunocompromised, if you have a risk factor. So the communication around vaccine has gotten very confusing, and there's boosters, and there's 3rd and 4th doses, and there's different age groups and risk factors, and so it's definitely a case by case decision. But the more we get vaccinated, particularly those at high risk, that's the best tool we have to prevent severe disease, hospitalization, and death. And that's really our goal. Mild COVID, while definitely, and I put mild, it can be pretty bad. It's an illness that's very uncomfortable and missed work days, and it definitely has an impact. But for us in the prevention world, what we really want to prevent is the severe disease, hospitalizations, and death, and that impact on our healthcare system, where we will see more severe disease if people can't access health, if people can't access the care they need because of the overwhelmed system. So that's our major goal. And remember, back at the beginning, we talked about flattening that curve. And that's still what we want to do, right? We understand there will be disease, but we want to make sure it doesn't overwhelm the systems that we have. And that's everything from healthcare, all the systems in our community. We want to make sure that we're able to continue to provide the care that we need.
Now, at this point, as far as I can tell, the only day-to-day reminder that COVID precautions are required is on the T. Right? Federal law requires wearing masks for certain kinds of transportation, which includes Uber and Lyft, mass transit, and airplanes. But as far as I can tell, there's no other sort of expectations around COVID for the general population in their day-to-day activities, right? So we're not obligated to wear masks in retail establishments or other locations. Our students aren't wearing masks in public schools. Is that a fair assessment of what folks should be expecting today in terms of COVID protection?
So I think masks are one community mitigation tool that we use. There are many others. I think with the warmer weather, being able to have functions outside, fresh air, HVAC systems, particularly when we're looking at the schools have a wide variety of mitigation strategies that they're using. And again, masks are just one of those that, one policy to mitigate the control and spread. Vaccine and testing are also huge effective mitigation strategies that we can use. So I think masks are very visible, and there's a lot of strong feelings on both sides of that debate. But I think we also need to concentrate on the other strategies that we can use also, and particularly increasing our vaccine rate and booster rate.
But at this point, all of those other strategies are really optional, right? There's no other mandate or obligation for public participation. Is that right? Right. And, I think we can strongly encourage and really encourage healthy behaviors. Also, all the same things that we said at the beginning: wash your hands, stay home when you're sick, isolate yourself if you are sick. So all those same things still are around, and we're still encouraging in our messaging. And it turns out that's not just about COVID, right? Like, I got the flu a year ago, and it was like October, November 2020. And I was like, hey, I don't actually have to infect the rest of my family with the flu. I could not do that instead. It was like the light bulb went off. Like, I'm sick, but I don't have to loiter around the rest of my family and make them sick. And so we made some changes in our behavior for a week, and sure enough, nobody else got sick. And that was better. And that wasn't COVID. That was just Sigalle, you're sitting there well, duh. This is what I've been telling people for decades. Well, I'm telling you, it's getting through. We're learning. We're slow, but we're learning.
Yeah, I remember at the beginning of the pandemic, when we didn't know much. It's hard to think back 2 years ago when we really didn't know what we were facing, and so we were encouraging just basic infection control. And I remember sitting around a table with the policymakers when I worked in Norwood, and said, well, when you get home, you wash your hands. And we was like, well, I don't do that on a regular basis. I said, what do you mean? So yeah, it was also having to understand what are the norms out there. And I think some of the norms that have changed, and that hopefully will stay because it's creating a healthier environment, is that increased washing hands. And you're actually a hero if you stay home when you're sick, because nobody in your office or workplace wants to be exposed. Where I think the norm a couple of years ago before the pandemic was, come on, toughen it out, take the Tylenol and go to work when you're sick. Nobody tolerates that anymore, and that's the way it should be. And that's the way we're going to control disease, especially communicable disease.
I'm glad you reminded us about how much we didn't know. And I think that future civilizations sort of look back at the moments and they're like, how did they get that wrong? How did they not know that? Right. And you lose these little anecdotes. I remember in March 2020 getting on the subway at Park Street Station, right, because it's near the State House, and walking down these long flight of stairs. There's a little end, there's another long flight of stairs, and debating whether or not I should hold the handrail. Because the handrail has got germs on it, which maybe that's how we get COVID. On the other hand, if I fall down the stairs, I could get really, really hurt thanks to gravity and physics. What should I do? And it was I ended up hovering over the railing saying, okay, if you start to stumble, just grab it. But, and sort of it's a very specific question, but it was a time when we really didn't know. Are we getting COVID from touching stuff? Turns out not really. No, getting COVID from breathing stuff. But we didn't know then. And it really did change our behavior. People, opening doors with elbows and stuff, right? and I'm not saying, lick the doorknobs, but you're not getting COVID from touching the doorknob, almost certainly. Sigalle, thanks for coming on the show. It's Public Health Week this week. We didn't get a chance to talk about it, but hey, we're talking public health, so we're talking about it. Sigalle, again, thanks so much. Welcome to Brookline. We're so glad you're here, and have no doubt you're gonna do great. Folks, you've been watching Brookline Interactive Group. I'm Tommy Vitolo. We're on just about every Thursday, and thanks so much for watching.